Several school districts in Florida and Texas are going against their governors and imposing mask mandates in the classroom. It comes as a new study finds the rate of transmission is.
Hello, today I present to you an extremely attractive application for music lovers. It's completely free. You can listen to music online or download unlimited music to use whenever you don't have internet. The powerful search function helps you find anything you want. Trust me. It's hard not to find what you're looking for because the search function is really powerful. Application download link is attached in the description of the video. I'm pretty sure you'll like it. Thanks.
Is elevated in schools even if adults are vaccinated. Children also now account for 15% of all new COVID infections, according to a new analysis by the American Academy of Pediatrics. CBS News national correspondent Manuel Bojorquez has more from Miami.
The first day of school in the Tampa area came with a mask mandate, but also a loophole. Parents can opt their children out. It's among the latest balancing acts with Governor Ron DeSantis, who is threatening to go after superintendent and school board members' salaries if they require masks in schools.
It's about parental choice, not government mandate.
But this afternoon, Broward County's board went against the governor anyway. In Texas, Dallas is defying that state's governor's rule against mask mandates.
He's responsible for the state of Texas. I'm responsible for Dallas ISD.
Nearly 94,000 new COVID cases in children were reported nationwide last week, the highest number of pediatric cases in nearly 6 months. The American Academy of Pediatrics issued a letter to the FDA saying it should strongly consider authorizing COVID vaccines for children ages 5 to 11.
We wanted the FDA to know that the biggest pediatric organization in the country really stood behind vaccines for children.
Dr. Yvonne Maldonado is the organization's chair of infectious diseases.
Is the fact that some students may go to school without wearing masks and that the Delta variant is so much more contagious, are those the reasons you're urging the FDA to act?
There's a number of reasons. First of all, we know that vaccines work. Secondly, we know that they're safe. Third, we know that masks work. And fourth, we know that masks are safe.
Florida leads the nation in pediatric hospitalizations, with more than 300 reported in the last week. It's overwhelming doctors like Pia Myers, who had this message.
I'm trying to encourage everybody to please take this Delta variant very seriously due to the transmissibility. It is incredibly contagious, and our children are getting sick. I can't do this.
Clearly overcome with emotion. We reached out today, but the FDA does not have an updated timeline on when children ages 5 through 11 could be eligible for the vaccine. In the meantime, Dr. Anthony Fauci says he believes the vaccine should be mandated for teachers, but that the decision should come from the local level. Elaine?
Manuel Bojorquez, thank you. For more, I want to bring in Dr. Payal Patel. She's an infectious diseases physician at the University of Michigan Medical School. Dr. Patel, welcome. As we just saw, cases are surging in Florida, but Governor Ron DeSantis is defending his ban on mask mandates in schools. Remind us, why might masks be needed in schools, and why might parents not want to mask up their kids?
Yeah, I've been doing a lot of research on this as part of my job. And in this last year, there have been a number of studies in different states, different school districts in the U.S. talking about ways to improve safety for kids when they are in school. And we know that vaccination is really going to be the best way to prevent transmission. But since we don't have that option yet, masking, ventilation, avoiding indoor crowding, these have been proven to actually really help decrease COVID transmission. So if we don't have that final tool in our belt, we have to rely on these others to get kids back to school safely.
Well, a recent CDC-funded study found the risk of COVID-19 transmission in schools is high with the Delta variant as the dominant strain, even with most adults vaccinated. How dangerous is this for children who cannot be vaccinated yet?
We are in kind of a new space. A lot of the research that I just talked about was done when the Delta variant was not the predominant virus that we're seeing in the United States, and we know that it's more transmissible. I think that we've learned from this last year that kids do suffer when they can't be in school. So getting them back into school in a safe manner until vaccination is available is really the way to do this. And masking, we know, is a tried and true strategy. So I think that is is where a lot of the push for masking for unvaccinated children is coming from.
So should parents consider a return to remote learning in the meantime, or do you think that mitigation measures will be enough?
I think that if you're a parent really pushing your school district to do some of the things that were just described in that story, the tried and true public health measures, ventilation, masking, you want to know where your school district stands on trying to protect your child as you send them back to school. Those are the tools that we have right now to protect children, and we hope that we're going to be able to add vaccination to that very soon this fall.
Well, preliminary data from the CDC shows fully vaccinated people make up 16% of coronavirus hospitalizations in June, but many of those cases involve people with pre-existing conditions or compromised immune systems. Still, doctor, do those numbers concern you at all?
You know, it's sad because we could be in a different place if we had gotten more people vaccinated. We knew that the vaccines were never going to be able to 100% stop all people from getting sick. And so we expect that there will be some breakthrough infections. And if you have a system that might have less immune system working at your strength, you would be at risk of these things. And of course, you may have a more serious infection leading you to the hospital. So I would say if there's someone like that in your family, that is really something also to consider as you think not just about yourself getting vaccinated, but others around you to try to protect those folks, especially if that might be a child or a senior citizen.
Well, scientists are reportedly discussing the possibility of a nasal coronavirus vaccine. How might this method be beneficial, and would it be as effective as a shot?
Yeah, I think these are in development right now. It's very interesting. You know, luckily we have a glut of really good vaccines already. So that's a great thing. But thinking about people who may be scared of a jab, maybe children, adolescents, so really trying to increase that group of people that may be worried about getting a vaccine in their arm, I think this could be an interesting way to go and would again add to our arsenal against COVID-19.
All right, Dr. Payal Patel. Doctor, always good to have your expertise. Thank you very much.
Thank you.